Hello everyone, my name is Bronwyn. I work in the Tasmania engagement team at the University of Tasmania. Thank you all so much for joining us today on what I assume is your lunch break to learn about our healthcare redesign courses. I'm going to hand over now to Dr. Sarah Pryor, who is the Director of Healthcare Redesign at the University of Tasmania, and she's going to talk you through everything you need to know about this course. As she's going, you'll notice in the bottom of your screens, there is a little Q&A button. If you have any questions, please fire them off in there, and we'll set aside some time to answer questions at the end, but I'll also be able to answer a few, hopefully, as we go. So there's no silly question, and anything that's on your mind, please throw it out there. We've got a nice small group today with us, so lots of time for everyone. But without further ado, I'll hand over to Sarah.
Thanks, Bronwyn, and hi everyone. Welcome to this session. As Bronwyn said, I'm the Director and Course Coordinator for Healthcare Redesign, which sits within the Tasmanian School of Medicine at the University of Tasmania. So I'm just going to talk a little bit about the opportunities for studying healthcare redesign and where that might take you in your current role within health services. So before I get started, I'd like to acknowledge my local Aboriginal community, the Palawa people. I'd also like to offer my thanks for the care of country for thousands of years and pay my respects to elders and ancestors and their legacy to us. So what is healthcare redesign? For anybody who's not familiar with the term, healthcare redesign is a systems-based improvement methodology, which focuses really on improving existing services and processes through meaningful and sustainable change, aiming for better health outcomes. So these outcomes can be for patients, for families, for staff, for services, or for whole organisations, and include a range of different things like clinical outcomes or economic outcomes. So healthcare redesign assumes that we don't actually have a solution to a problem. So redesign has 5 distinct phases where we start with identifying what the problem is or what the problems are, and then mapping the processes around those problems. So that might include something like the patient journey or mapping and administrative processes. We then undertake what we call a diagnosis of the problem, which is looking at all the evidence to support that problem. So things like a root cause analysis, looking at organisational data, talking to patients, families, staff, all those sorts of things. And this ensures that we have a really good understanding of what that problem is from a whole range of perspectives around what's actually currently happening on the ground. So we then use this diagnostics information and a range of engagement strategies to develop evidence-based solutions to the problem that was identified. And then the final 2 phases are around implementation of those solutions and the evaluation of the outcomes, short-term and long-term. So a very brief overview of healthcare redesign there. So as I said, healthcare redesign is around systems and processes. So it's a problem-solving methodology. We don't jump to solutions. We encourage co-design and engagement with patients, with carers, with staff and with communities. We aim to give healthcare staff the time that they need and the tools that they'll need to tackle different sorts of problems. We look at bottom-up initiatives, so on-the-ground issues to strengthen frontline buy-in. We look at taking small steps to improve health services, as well as some of those bigger leaps across organisations. And as I said, it's really about systems thinking, so it's a no-blame approach to change. So the healthcare redesign program, it's really set apart by the way in which it's delivered and the types of outcomes that we can achieve. So students who undertake our healthcare redesign courses develop skills in redesign based on methodologies that have proven outcomes, as I said again, for organisations, for staff, and of course for patients, families and communities. And as a teaching team, we fully support students through a workplace project, which I'll talk about a little bit more in a moment, which is something that's been identified as a need in their own work area, and it also aligns with organisational strategy and organisational values. So working with our organisations in this way means that we can make those meaningful and sustainable changes, while also providing students an opportunity to attain postgraduate qualification. So the graduate certificate in healthcare redesign is work integrated learning, so it does incorporate a workplace project. We have students from across all facets of health services, so nursing, allied health, medical, administrative, leadership, support services. We have paramedics, pharmacists, pathology workers, radiologists. So really from any professional background in health services, you can undertake a Redesign course. It is a full postgraduate level qualification. And we aim to build knowledge and culture of change within organisations. So developing local skills to look at solving current problems as well as future challenges within health services. So I'm going to talk a little bit about the graduate certificate during this presentation. We do have 3 levels of qualification, so the graduate certificate, a graduate diploma and a master's degree. I'll touch on the latter 2 a little bit later in the presentation. But all of our courses are delivered online, and we do have optional face-to-face days provided at the graduate certificate level within a student's organisation. So those face-to-face days are what we call masterclasses, and they're delivered around our project units, which I'll go over shortly. So the graduate certificate in healthcare redesign is a 1 to 2 year part-time graduate certificate. We have 4 units. And flexible study options. So as I said, it's fully delivered online, but we do have optional face-to-face intensives and support. So as I mentioned, this course is what we call blended learning. So it involves a combination of learning styles, the online, the face-to-face and the workplace integration through a workplace project embedded in the graduate certificate. So the 4 units within the graduate certificate are listed here. So the first unit is an introduction to healthcare redesign theory and approaches within healthcare redesign. It looks at change management, leadership and systems thinking quite broadly. And then the following 2 units are our project units. So they're what we call CAM 509 and CAM 510. So the first project unit really gets you looking at scoping your project or identifying that problem and doing that diagnostics phase, so collecting the evidence around that problem. The second project unit really focuses on developing those solutions and developing an implementation and evaluation plan for when those solutions are actually implemented. These 2 units are the units which have the optional face-to-face masterclasses, but if students are unable to attend those masterclasses, we also run them online as well. The final unit in the graduate certificate is a fully online unit focused on translation of research into practice. So this unit looks at the implementation science and how we can successfully translate knowledge into practice in healthcare. So the Healthcare Redesign teaching team are a very passionate group of educators. And I think one of the reasons we work so well with our industry partners is because we actually really care about improving service delivery, improving the experiences and outcomes for patients and staff. And as part of that, we also want our students to get the most out of these courses. So we do provide a lot of opportunities for in-depth discussions within the units, working closely with students on their projects. And we have a lot of one-on-one time with our teaching staff and students as well. We really just want to get you set up for success. A successful project also means that you learn a lot more as you move through this course. As previous clinicians as well, we know that it's really important to learn while you're actually doing things in healthcare. That experiential learning is really valuable, particularly in a problem-solving sense. And just to give you a little bit of background, our teaching team includes a midwife, a dietitian, a stroke research fellow and 2 virologists, which is purely by coincidence. So we do have a bit of a wide range of clinical skills and clinical knowledge in different spaces. So the recommended pathway for the graduate certificate in healthcare redesign is 1 unit per semester. Obviously, all of our students will be working at the time that they're undertaking this course in different capacities. There are 3 semesters, so semester 1, which runs from February to June, semester 2 is July to October, and we also have a spring school extended semester, which runs from October to the end of January, early February. We do have those 3 semesters purely to allow students to keep going with their projects. So if you're in the middle of a project at the end of October, we then don't want you to have to take 4 months off study and then come back to it. So we offer that consecutive study pattern through those 3 semesters. For the units, the study load is approximately 8 hours a week. That will increase at particular points during project deliverables across those 2 project units, but it will even out across the semester. So some weeks it might be a bit less, other weeks it will be a little bit more, depending on what your project is. We do accept group projects for the course. So if you have 2 or 3 people in one area or one department that want to do one project, they can come through the course together. We just make sure that those projects are a little bit larger in scope so that each student has the opportunity to contribute equitably to that project. So the cost for the graduate certificate in healthcare redesign, currently we have a 50% fee waiver scholarship available for students in a number of health service organisations across Australia. And the remaining costs for the units on the course can be paid upfront, or they can be accumulated and paid off over time using the HECS Help Debt system. So some of the graduate certificate projects that we've seen from students over the past few years are listed here. As you can see, there is a really diverse range of projects, and other projects include things like redesigning process for OT rehabilitation, delivering optimised nursing and midwifery recruitment strategies, improving access to addiction and substance use services, redesigning postnatal depression education materials. So we see a lot of different projects come through the course. So the entry requirements for the graduate certificate in healthcare redesign. So anybody who's completed an undergraduate degree in an Australian higher education institution or equivalent at any other institution, and equivalent experience or qualifications as deemed appropriate within the university. So if you're unsure about whether you're eligible to join the Graduate Certificate of Healthcare Redesign, I would encourage you to reach out to me and we can have a discussion about that. So the UTAS application process for the Graduate Certificate is all done online. So anyone interested in the course, I would also recommend you discussing your application with your line manager or somebody who will potentially be working with you or overseeing your workplace project, just to make sure that you do have that support within your organisation. If you don't have a workplace that will support a project, or you don't have a particular project that you are able to do, we also offer virtual projects that we have set up for students in that position. If you think that might be you, again, please reach out and we can have a chat about what that looks like in terms of the course overall. Not quite sure if the healthcare redesign is for you. We do actually have a free online course, so a MOOC, massive open online course, which is an 18-hour course, which really gives you a broad overview of the healthcare redesign graduate certificate. It goes through the healthcare redesign approach to change, the theory behind the methodology, and goes through each of the 5 phases that's involved in the healthcare redesign process. So if you wanted to jump on and have a look at the MOOC, you can enrol anytime. It's not time limited, so you don't have to do it in a set amount of time. Once you've signed up, you've got the content forever as well. So I would encourage you to have a look at that if you're not 100% sure about redesign at this point. And as I mentioned earlier, we do have the 3 levels. So the graduate certificate, which I've talked about, there is a graduate diploma in healthcare redesign, which is another 4 units on top of the graduate certificate, and then a further 4 units or equivalent for a Masters of Healthcare Redesign. The university also has an advanced practice specialisation, of which health service improvement is one of those specialisations. So that's more of a sort of choose your own adventure type graduate diploma and master's degree. Some of the other specialisations in that graduate diploma and masters include healthcare education, governance, supply chain and logistics, workplace psychology, dementia and organisational performance. So that's another pathway following the graduate certificate in healthcare redesign. I just thought I'd pop this slide up. So there are other opportunities in redesign available. So I just wanted to mention this really to demonstrate one of the ways in which redesign can open up different opportunities and different pathways for people in health services. So we've had a number of our previous students go on to start PhDs with us, looking at projects around things like redesign and leadership, redesigning the emergency department via clinical pathway research. We also have a current PhD opportunity open around using implementation science to improve emergency department care as well. So lots of different opportunities within and sort of sideways to health services with redesign. So if you have any questions or queries about anything to do with healthcare redesign around the courses or the approach or the research or just change in general from a redesign perspective, please feel free to ask them now or reach out to me at any time in the future.
Thank you so much, Sarah. Because we've got a nice small group, what I'm going to do is just flick the settings and allow people to talk, so you can either jump on and ask a question, or you can pop it into the Q&A function if you'd like. Just to let you all know as well, I noticed a few people joined as Sarah was going through the presentation. This presentation is being recorded, and I will, once I've had a chance to download it and then trim it, I will send it out to everyone so you can go back and rewatch. But yeah, please go ahead and ask some questions while we have Sarah here. Go for it, Lucy.
Oh, so, well, it was just more of a comment. I'm trying to think of. Thank you so much. My name's Lucy. I'm dialing in from Queensland. I work in a clinical redesign role, but that was a really great overview of the course, because I guess I've been wandering around, what is involved in each of the courses. But it was really nice to hear that the fourth course is around implementation science. I didn't realise, based on, I feel like I've done lots of reading recently, but must have missed that. So really nice to. That was very much of interest to me. So no other comments, but it was very interesting, and look forward to hopefully registering soon. So thank you.
Thanks, Lucy. Yeah, it's a really important point too. We often do a lot of project work or developing solutions and implementing them, but then there's no support around actually how to make sure that implementation is successful and what is the theory behind making sure things change in health services. So yeah, having that final unit has been really valuable for our students.
Thank you. And my other comment or questions, I've been doing a fair bit of reading recently around change management approaches outside of health or, industry. So I'm interested in, I think in the first course, you talked about some change management practices. Is there specific sort of methodologies you lean on, or is it a bit of a broad, is it agile? What is it agile? Well, what sort of things do you cover in that space?
Yeah, so change management's actually a really big part of that first unit, because it's a bit of an introduction to then how to use it as part of your project in that second and third unit. We look broadly at different change management frameworks, but we specifically focus on things like Kotter's 8-step model, the ADKAR model, Rogers Innovation Adoption Curve. But again, we encourage students to step outside of that and look at what change management frameworks might actually work for their own organisations or the changes within their organisation. So yeah, we do focus on a few, but we encourage a more broader look. Yeah.
Thank you. Thank you so much.
Thanks, Lucy.
Do we have any more questions from anyone else? Okay, well, I'll take that as a no and assume that everyone got all of their questions answered by Sarah's very detailed presentation. There was a slide on there around how to apply. Just to give you a little bit more information about that, you can just jump on our website and follow the links for how to apply. You just select the course that you're interested in. I note that a lot of you are probably from outside of Tasmania, so something that is a little different about our university compared to others is that it is completely free to apply. There's no application fees. You don't have to go through QTAC or UAC or any of those. You just apply directly to us. It's a very easy step-by-step process. Once you've done that, our admissions team will get back to you with an offer. You'll be able to accept that and then enroll. And with the scholarships that Sarah mentioned, those are applied after the point that you enroll. You need to complete an employee declaration for that. But I will follow up with some additional links in an email along with the recording for those of you who would like to progress. But yeah, Sarah, unless there's any final comments or anything like that that you might like to make, we might let everyone kind of get back to their work days.
Yeah, I just wanted to say, if anyone does log on to the free MOOC, which is the links online on the screen now, all of the application information and scholarship information is in the MOOC as well. So you can find it there as well.
Okay, fantastic. Well, thanks again so much to all of you for coming, and to Sarah for your time. And hopefully we will see you all as students at the University of Tasmania in the future. So thank you all, and goodbye.
Thank you.
Thanks, everyone.